Friends, female urology or urogynecology, that means urinary issues in women, may be a neglected subject. May be neglected because women as such may not complain or complain very late, or may not be getting the right therapy because they probably have not gone to the right individual in the right location. Women across the country living in two-tier cities and beyond the metros don't get a great access to the urological care all the time because they perhaps don't see a urologist. A urologist in any location is keen to take care of female urological problems and look at the aspects that women suffer from. So women suffer from aspects of urology which needs to be made aware to them. What are they? Number one, recurrent urinary tract infection. Women suffer from recurrent urinary tract infection, getting urinary tract infection of burning in urine, pain while passing urine, sometimes some bleeding in urine, difficulty and discomfort and burning and pain, which could be an acute episode. It may be starting yesterday, tomorrow, yesterday kind of thing, and probably will continue for hours and days. Could some therapy happen around, some urine culture done, and some bacteria could be killed, but that may not completely treat her. I said recurrent urinary tract infection is more common in women than men, only because the issue of the urinary system in the women compared to men. It's all about the organ systems where the introitus is soiled with bacteria from the vagina and the rectum. And women, despite the best of the hygiene, may sometimes miss out on that important aspect of care where bacteria are still laden and can infect. So it's important for young women to middle-aged, postmenopausal, elderly women to be knowing that recurrent UTI can be treated, can be prevented. So on one side, we find out the cause of recurrent UTI, which could be obstruction, which could be not emptying the bladder completely, which could be requirement of more amount of hygiene, which could be a passage that is tightening up in a postmenopausal woman where she doesn't empty her bladder completely, or she could be long-standing diabetic where on the ultrasound you find a large amount of urine left in the bladder even after emptying the bladder, and that is something where the high residual volume or post-word residue could cause infection again and again. A diabetic woman as such are immunosuppressed, and a mild UTI can flare up and can even go to the kidneys and cause pyelonephritis. So recurrent urinary tract infection can be treated and cured by a urologist, and that we see very frequently women coming after months or years of treatment of antibiotics and missed out. So there are probiotics, there are causes to be identified, there's a therapy to be taken. Some people require a cystoscopy, and we identify the need of that. Some women develop incontinence of urine or not able to control urine. So urinary incontinence is another very important aspect of women where women leak urine, they live with incontinence, they've got more frequency, urgency and urge incontinence, and they continue to live with it. Sometimes women in their postpartum situation after deliveries and thereafter multiple deliveries and thereafter the changes at the menopause post stoppage of menstrual periods could actually land up with stress incontinence. Now, what is that? It's not a mental stress, but it creates a mental stress now because the stress incontinence terms is about the stress to the lower abdomen, which causes leak. So when you run, jump, laugh, get up the stairs, get up the bus and bend down to work, bend down for your prayers and you leak urine, you're going through a phenomena called as stress incontinence. The leakage of urine that happens, unfortunately, exclusively in women and not in men. Men develop that only when they have a prostate surgery or a sphincteric issue and something has gone wrong at the level of the sphincter, which unfortunately in women happens because of the pelvic floor changes, post-delivery, post-stretch, post-injury, post-trauma, or post-menopause when the whole thing is gradually weakening and loosening up in the pelvic floor. So women develop stress incontinence, unfortunately by nature, by change, and that epidemiological phenomena could be suffering issues in 9 to 43% of Indian women. So if that is a survey, women suffer with incontinence of urine and we don't get to see them, it is important for us to wake up to a phenomena that women in her 40s, 50s, 60s could be having urinary incontinence, either of the urge kind, where she cannot reach the washroom, or of the stress incontinence kind, where coughing, running, jumping, and even laughing can cause leakage of urine and therefore a life on diapers. Very important for us to know that female urology issues are completely treatable and curable, and many of our patients across the world go to our gynecology colleagues who are equally equipped but will require a urological help many a times. Now, when it comes to bladder pain syndrome, where when the bladder fills up and you have got discomfort, pain, etc., it is important for us to wake up to that phenomenon. So women suffer from UTIs, women suffer from incontinence, women suffer from bladder pain syndrome where the pain, discomfort, and the pressure in the lower part and the burning sensation there is not getting treated. These kind of women need to see a urologist working deep into the female urological aspects and taking it to the next level. Women also suffer from aspects of changes happening around where the urethra can tighten up, and there could be stricture urethra, which in softer strictures is dilated, and in longer and long-standing strictures undergoes a female urethroplasty, where we change the life like in male urethroplasty. We get the urethra back to its normal caliber. We need to look into those patients who have got a bladder which is getting smaller and smaller in interstitial cystitis bladder pain syndrome, where a small capacity bladder makes you go to the washroom multiple times and you're not able to control because of pain, discomfort, while the bladder capacity has shrunken. Many of these women land up with us getting an augmentation or a substitution cystoplasty where a diseased bladder is removed and we get a new bladder from the intestines, where she could then empty the bladder with Valsalva's maneuver and do well. Women also could be born with MRKH syndrome, where at the time of menstruation and growing into adolescence, there is no menstrual periods. MRKH syndrome or Mayer-Rokitansky-Kuster-Hauser syndrome, where women are born without uterus and vagina, and those women may not have any menstrual periods, and they're growing very well and are feminine in their aspects of menarche because they have got the ovaries and therefore all the female hormones. But the end organs of uterus and the vagina is missing, and therefore no menstrual periods, and chances of their fertility and their partnership with men is missing. Such kind of women deserve a vaginoplasty, creation of a new vagina, where we create a vagina by a sigmoid colon or a peritoneal flap, and that vaginoplasty in both transgender individuals, male to female, and in women with MRKH syndrome, get a great result and a great benefit. So when we look at women going through all this, women also go through vaginismus, where the vaginal contractions are massive and they cannot undertake a coitus or a sexual phenomena, would sometimes require a botulinum toxin in refractory vaginismus to allay the fears and the contractions of this massively contracting vagina. And these are aspects which you need to look into. So women suffering from urinary issues and sexual issues is not uncommon. Sadly, these are all swept under the carpet. They are missed out. They live in agony. They live in a lot of distress and disgust, not knowing whom to see. And urologists look into that. In the Urology Society of India, there is a full subsection right now on female and functional urology, and it feels proud to be doing that subject at the Kokilam Dhirubhai Ambani Hospital amidst our colleague urologist in the second floor department of urology. And female urology is a subject that needs to be taken to the highest levels. So for all women who suffer from incontinence, recurrent urinary tract infection issues, we need to take them to the next level and help them out. Thank you so much.